Hi and Assalamualaikum, madam. Today, we group 3 will present to you topics from gene mutation, which are effect on best substitution and anemia. In effect on best substitution, there are three types of mutation, which is nonsense mutation, silent mutation, and missense mutations. So today, I am Amalia Liana will present to you about missense mutation. Missense mutation. Missense mutations change a codon to one that encodes a different amino acid and causes a change in the protein produced. Missense mutation occur when there is a mistake in the DNA code and one of the DNA base pairs is changed. The effect of missense mutation is a new nucleotide alters the codon so as to incorporate a different amino acid in the protein product. As we can see, there are glutamate, which is GAA, but after the displacement, C replace A and turn the protein into the aspartate. So, missense mutation happen here and change the product. So let's go to Aruna to present about silent mutation.
All right, thank you for Amalia. Now I'm Aruna here. Will be further discuss about silent mutation. Silent mutation sometimes occurs when a change in a base sequence may transform one codon into another that is translated into the same amino acid. Silent mutations are said to be silent because they cause no change in their product and cannot be detected without sequencing in the gene, which means the final product will be no change. Here I have attached three examples of silent mutation. As you guys can see here, the normal mutation is TTC. But then after the silent mutation, the C is replaced by T, which is triple T. But then at the final result in protein level, the product produced is also the same, which is lysine. Same goes here. In the silent mutation, the A is replaced by G, but then the final product for this protein is glucosamine, which is the same product. In example 3, I hope you guys can see the changes in the silent mutation, and I hope you guys understand what is silent mutation. That's all from me. Thank you. Now I will proceed this discussion to Navina Sri to further discuss about nonsense mutation. Thank you.
Thank you, Aruna. I am Navinasri here. I will be present about nonsense mutation. Nonsense mutation is the mutation that changes a codon for an amino acid into one of the stop codon, UAA, UGA, or UAG. This mutation can cause translation to be terminated prematurely, and the resulting polypeptide will be shorter and leads to non-functional protein. Here, the wild-type DNA suffer a change in one base pair where base A changed to base U. This results in appearance of stop codon in new mRNA and cause the premature synthesis of polypeptide. Thank you.
Okay, thank you, Navina. So, I am Muhammad Arif bin Azlan, and I am going to present the differences between missense, nonsense, and silent mutation. As has been stated by my peers before, there are three types of genetic mutation when it comes to base substitution. So the difference is very simple. For missense mutation, the altered codon codes will for a different type of amino acid. This is due to the fact that there is a change in the polypeptide chain and will lead to a less active protein. For silent mutation, the altered codon will code for the same type of amino acid. Even though there is some changes in the bases, because there's a base substitution that happened, the amino acid that resulted from the change of the base did not change. So the polypeptide chain also did not change, and so there's no change in the protein that is produced. In nonsense mutation, the codon will be altered to a stop codon, which is either UAG, UAA, or UGA. When the codon is altered to a stop codon, it will create in a shorter polypeptide chain. So this will result in a non-functional protein. So that is all for me today. So the discussion will continue with Iza. Thank you.
Thank you, Arif. My name is Iza and I'll present the sickle cell anemia. So, sickle cell anemia is actually an inherited disorder that affects the red blood cells, which means it can be passed from parents to the children. And sickle cell anemia is actually a type of missense mutation. So, people can have sickle cell anemia due to the gene substitution, where the amino acid valine is replaced with glutamic acid at a single position in the protein, which is in beta strand. So, the mutation will causes the hemoglobin to form strands in the red blood cells, which makes them inflexible and present in sickle shape, which is why this disease is called sickle cell anemia. So hemoglobin in sickle shape is stiff and tend to cause blockage in blood vessels that can lead to sickle cell crisis, or even worse, it also can cause a stroke when there is a blockage in blood vessels in brain. The abnormal hemoglobin is not efficient in transporting oxygen to the cells in tissues and organs because of its shape, so the patient will suffer from anemia. So in this diagram, we can see that a child can have sickle cell anemia when both of the parents are carriers. The chances of getting a child with a sickle cell anemia is 25% with a ratio 3 to 1. So that's all from me. I'll pass it to Aida.
Thank you, Iza. Okay, my name is Aida. I will talk about the difference between normal red blood cell and sickle cell anemia. For the normal red blood cell, thymine base pairs with adenine in DNA. During transcription, thymine base transcribes into adenine. Codon GAG will undergo translation and translated into glutamic acid in polypeptide chain of normal hemoglobin. Contrastly, in sickle cell anemia, thymine base has been replaced by adenine in DNA sequence. During transcription, adenine will be transcribed into uracil. Codon GUG will be translated into valine in sickle cell hemoglobin. That's all from me. Thank you.
Thank you, Aida. I'm Anisha Shahira. We'll continue this with effect and symptom of sickle cell anemia.
The first one is stroke. Sickle cell can block blood flow to an area of your brain. Signs of stroke include seizure, weaknesses, and numbness of your arm and legs, sudden speech difficulty, and loss of consciousness. If your child has any of these signs and symptoms, seek a medical treatment immediately. A stroke can be fatal. The second one is acute chest syndrome. A lung infection or sickle cell blocking blood vessel in your lungs can cause this life-threatening complication, resulting in chest pain, fever, and difficulty breathing. It might require emergency medical treatment. The third one is pulmonary hypertension. People with sickle cell anemia can develop high blood pressure in their lungs. Complications usually affect adults. Shortness of breath and fatigue are common symptoms of this condition, which can be fatal. The fourth one is organ damage. Sickle cell can block blood flow to organ-deprived and affected organ of blood and oxygen. Sickle cell anemia, blood is also chronically low in oxygen. This lack of oxygen-rich blood can damage nerve and organs, including your kidney, liver, and spleen, and can be fatal. The fifth one is blindness. Sickle cell can block tiny blood vessels that supply your eyes. Over time, this can damage your eyes and lead to blindness. Leg ulcer. Sickle cell anemia can cause open sore on your legs. Gallstone. The breakdown of red blood cells produces a substance called bilirubin. A A high level of bilirubin in your body can lead to gallstone. Priapism. In this condition, men with sickle cell anemia can have painful, long-lasting erections. Sickle cell can block the blood vessel in the penis, which can lead to impotence over time. And the last one is pregnancy complication. Sickle cell anemia can increase the risk of high blood pressure and blood clots during pregnancy. It can also increase the risk of miscarriage, premature birth, and having low birth weight babies. Okay, that's all. Thank you.